Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello, my name is John. I'm 57 years of age. Last June 2013 I was diagnosed with penile cancer. I am married. I have 2 children, a little boy aged 12 and a little girl aged 4. Also I have other complex health issues which also came to the equation during my cancer treatment. Since then I've had wonderful support both from the hospital and all the relevant backup services. I'd like to think in the making of this video that it will help other people with their cancer, whether it be the same as mine or a different type, and to try and get some sort of help and support from watching this video, and to realise that there is people the same as you, have the same feelings as you, same emotions as you, and the help is out there, and there are people that understand very, very well.
John, thanks for coming in today to join us on this Cancer Stories program. I'm very intrigued by your account because I know you've had one of the more unusual cancers, which you mentioned at the beginning, a penile cancer. And it's important that we give adequate space to everyone who's got various types of cancer in the program. So I appreciate you joining us. Can I actually ask you about your early history first of all? In other words, what was your health like from a child and then developing? Because I know you had an unusual start to life, didn't you?
That's right. I was born with something called ectopic vesica, which is when the kidneys are formed the wrong way round and the bladder is formed outside the body. Unfortunately, I spent the first 8 years of my life in the Leicester Royal Infirmary, and also unfortunately there wasn't a lot of support from my parents. Although I was born at home, Mum and Dad seemed to think it wise at the time that they just took me to A&E at the Leicester Royal and I was just left there. All of this involved quite a lot of major operations, which carried on until I was around about 8 years of age. And since then I've been seeing a consultant every 3 months.
Yeah. So you had quite a lot of early life experience in the hospital.
Yeah.
So much so that you almost were kind of living there for
That's
quite a
right,
while.
yeah. It was my home for the first 8 years of my life.
Is it still vivid in your mind? That
Very,
time?
very vivid.
Yeah.
Very vivid.
I'm intrigued, you know, when somebody spent that long in hospital as a youngster, did it just seem normal to you?
I didn't know any different.
Yeah.
I thought that was the norm.
Yeah.
And I thought that's where babies went until they was old enough to go home.
Yeah. And what was the situation with your friends and that? Were you able to make friends, or were they friends from the wards? And that
the only friends I had was like doctors, nurses, and whatever patients was on the ward at the time.
Yeah. Looking back on that time, do you feel that influenced your later development, or did you just kind of make an adjustment to it because that was just normal for you?
It definitely influenced me. It made me a very determined person, and anything that came along, I tried to beat it in my own way.
Yes. So later, obviously, I know that you were diagnosed with this penile cancer. Do you think that was at all related to that unusual medical history that you had?
That was a question I asked my consultant when he first diagnosed me.
Yes.
And he says it wasn't related at all. Anybody could have got it.
Two independent
Totally independent.
conditions in a way.
Yeah,
So
totally independent.
How did your your cancer diagnosis come about?
My diagnosis came about was when I noticed two very tiny lumps in my groin, which I went to my GP with straight away.
Yeah.
Because of health issues in the past, you don't tend to delay when there's anything wrong. And he organised a biopsy, and it was found that there was the secondary cancer.
I see.
So obviously from then on they had to find out where the primary was, and it turned out to be penile cancer.
Had there been a scan, or was it early symptoms that gave the indication of those initial lumps?
What it was, when they did the scan, they found cancer at the base of the penis and also in my lower intestine.
Yeah.
And it was obvious from scans after that that it was getting worse quite rapidly.
Had you had any symptoms or signs down in the penis area?
Absolutely nothing whatsoever, just these two lumps.
Yes.
But then obviously as the cancer progressed, physically I went downhill, lost a lot of weight.
Yeah.
But in fairness to the hospital, because they had to get so many consultants together, it was quite a while before I actually went in for my operation.
Right. Now, I know the operation was a major operation in itself, but prior to that, was there any other treatment given to prepare you for that operation?
No, unfortunately, there wasn't any medical treatment because of what would happened in the past and the different issues I was born with. They wanted to wait, and they could sort everything out just in one fell swoop, as it were.
I see. Now, what did the operation actually involve?
What they did, they made an incision from the bottom of my chest down to my penis, and two incisions at the side down to my penis. Unfortunately, they also found a hernia and an ulcer. All the cancer was removed, the hernia was sorted out and the ulcer. And then, because I'd lost so much weight, they wasn't able to do skin grafts from any part of my body. So they had to use a procedure using pig skin, and everything was reconstructed. Both my stomach and my penis was all reconstructed using pig skin.
Wow.
And luckily everything came back together and working fine.
That's good to hear. It sounds like an incredible operation. Was that a new thing, cutting edge? You know, I haven't heard of that before.
Never done it before in this country. I was the first one.
Really?
Yeah. So hopefully anybody who's unfortunate enough to get that in the future, don't think all is lost.
No.
There is things out there that can be done.
Yeah. Do you know what they used to offer before this?
Well, what it would have meant if they couldn't have done that would have been complete removal of the penis. I mean, obviously, especially obviously for a man, it's going to have a major psychological impact.
Yes.
Especially if you're married or you're in a relationship, whatever that relationship may be.
Fair enough.
There is going to be the impact. So really, I was very, very lucky to have such expertise close at hand.
Yeah.
Very lucky.
What were you told about the upcoming procedure as time ticked down to the operation? Did you know enough about it, or were things rapidly developing and they were kind of updating you on a regular basis?
They was updating me like sort of every week, One of the consultants or the registrar would ring me and say, well, obviously ask how I was, and say, right, we've thought about this, we've thought about that. And I don't really think they knew themselves until the last minute, till we could get all three consultants together, exactly how it was going to go. I mean, luckily, it went as planned. And everything turned out so well. It was just amazing. After such a gloomy start, thinking if this was going to be really, really life-changing, to think that you was going to, like, if you like, not be a man anymore.
Yes.
And not only that, it's the impact on your wife. It doesn't matter how long you've been married or how much you love each other, it's still going to have an impact. Because at the end of the day, everybody needs a physical side to the relationship.
Definitely.
Whether that be, you know, small amounts, large amounts, it doesn't matter. Everybody needs that side.
Yeah.
And obviously you have the impact on the rest of the family, because if mum and dad are not happy, children are not happy.
Let's ask you now about how that initial diagnosis was handled, and I'm thinking initially about the consultation, you know, where you go in, you might be expecting some bad news or, you know, some information that you're under investigation. How was that handled, and what do you think about that, looking back on it?
Looking back on it, I think the consultant concerned, he handled it really, really well. The only downside of it was, obviously, I didn't expect that news, and I took my wife and children with me.
Yeah.
My first thoughts when the consultant sat us all down and told me was for my family, because straight away I looked at their faces. For myself, it didn't hit me straight away, because I was expecting it to be something to do with health issues I'd had in the past. I never expected to hear that word. And it doesn't matter what people say to you, that word is always going to have a stigma. It always will. And you always think the worst. You think, your first thoughts is probably, how long have I got? And I think that is quite a natural reaction. And it's not until you go further down the line that you can see that it's not going to be that. And that you are going to get the best treatment possible. People are there to help you. And it's at times like that when also you see probably the true side of your family as well. And you realise how much they care for you, how much they love you. And they're all fighting with you. Even my little girl, although she's only 4, you could see her changing her. You know, we must look after Daddy and things like that. And all that comes to the fore. And at the time, that is such a great help, a great help. But as for my consultant himself, I thought he handled it marvellously.
But if I understand you correctly then, so you were going into the consultation not necessarily expecting a cancer diagnosis?
No.
You were just under investigation in general terms?
That's right, yeah. I didn't expect the cancer diagnosis at all. It was totally a bolt from the blue.
What was your emotional reaction overall to that, you know, that dreaded diagnosis of the cancer?
My first reaction was, if I've not got that long and I'm going to pass away, how will my family manage?
Yeah.
That was my first reaction.
Yeah.
Not necessarily for myself. That came further down the line.
Were you noticing in the consultation how they were reacting?
Yeah, I noticed straight. I mean, I could see tears in my wife's eyes and tears in my boy's eyes.
Yeah. And
then something sort of clicked inside. You've got to be strong. Don't start breaking down. Not now. Do it later. And my feelings were more for them initially, not necessarily for myself.
And they can take a cue from you if they see you coping.
That's
they
right.
will feel, oh, it can't be as bad as I'm fearing. Do you know what I mean?
Yeah, and that's why I wanted, especially for my children, I wanted to be strong for them.
Yeah.
And show them that Daddy wasn't frightened and Daddy was going to beat this. No matter what, I was going to beat that.
They were going to see that determined outlook in you.
That's right.
And your son was there during that consultation?
That's right, my son.
How old was he at the time?
12. So obviously he understood. I mean,
Yes.
he's not a silly child. He
No.
understands these words,
Yes.
and he knows what they can mean.
Definitely.
And he's seen it with probably his friends' parents or grandparents that have died of cancer, or family members in the past,
Yeah.
and he understood.
Now, after that initial news was given to you, sometimes in families, you know, it's not clear whether you want to talk about it, but some families, you know, they go home, they do want to talk, and they're able to discuss it themselves.
Yeah.
Sometimes it's too painful to do that, though, at that moment. What was the situation in your family?
Well, when we got home, it was getting quite late. My wife got my little girl ready for bed, and I'll be honest, the first thing I did, I went for a walk. I took my dog a walk, and I just needed to get my head together and think, well, how am I going to handle this? How am I going to handle the family? How am I going to talk to my children? How am I going to talk to my wife? And I just needed to get it clear in my head, because I didn't want to go home and be a blubbering wreck, as it were.
Yeah.
I wanted to try and be as calm as I possibly could and be strong, not just for me, but for them.
Yeah.
I needed to be strong for them.
And in terms of that dialogue, did you find that you were able to have a discussion with them at later points?
What I did, my first reaction was for my little boy. I had a chat to him, and obviously you tell them not to worry, but they do worry. And then once that was over and he'd gone to bed that evening, it was, I think me and my wife stayed up to some ridiculous hour of the night, just talking over everything. I'll be totally honest, I'm not going to say it made me feel better, but I think it made my wife feel better, but not necessarily me. I didn't start to feel better psychologically until I started to talk to outside people, not necessarily family, people who understood, people who had been through it. And then I started to feel better, because I knew that it's not just me, there's loads of people like it. And although I love my family to bits, they were not necessarily the right people to speak to for support. Yes, they are there for you, for love and emotions, backup, but sometimes the outside people do just as good a job, if not better. Which
raises a question in my mind. We're skipping ahead a little bit, but still relevant. What support did you find came your way through this cancer journey?
Well, Macmillan got involved more or less within a week or so. I had a phone call from Macmillan nurses to arrange an appointment to pop out and see me. Also, they met my wife, met my children, got some history and background of, you know, how things were going. Spoke about relevant support services, gave me all sorts of leaflets and information that I could access. And also it was good for my wife as well. I think she found it very helpful, and she was absolutely excellent with the children. I mean, she understood what they were going through. And then obviously I came to the hospital, to the Macmillan Centre, and got wonderful support there, really, really good. And I came there a few times to see different people. And even when I was in hospital, you know, the support was there. And they'll perhaps only spend a few minutes with you while you're in hospital, but it's somebody different to talk to. And it means an awful lot. And I think, I mean, I like to think I can open up to most people. I know a lot of people probably find that difficult, especially a stranger. But if you can, that will help you an awful lot. You know, letting your emotions go. And if you need to cry, then cry. Don't bottle it up, let it go.
Do you think it's hard? I mean, it could be hard for anyone, but for males particularly, to show their emotions?
Yeah, I think because there's like always this stigma of you've got to be the strong man and so on and so forth. But at the end of the day, everybody cries. I don't care who they are, whether you do it in private or whether you do it in public, everybody cries. Did
you feel that all the services were available at the right time, or could it be supplemented? Even if it wasn't for you, I mean, you might have seen how other people were attended to, you know, who are on the wards at the same time or in the clinics.
I mean, I can only speak personally, obviously, but for myself, yeah, I mean, I got everything I wanted. And I knew if I wanted to talk to somebody, I could pick the phone up or go online and have a look at links and things like that. There was all sorts of things out there.
Yes.
I mean, I appreciate probably everybody's not got the technology at home to deal with, but you can still pick the phone up, make a phone call, and there is ways to access things. There's always a way.
That's true. In fact, with the improvements in technology, that's getting bigger and bigger all the time, isn't it?
Yeah.
What was your experience of the online community? What did you come across?
I think what helped me the most was seeing how different people cope with I mean, didn't see anybody with the same type of cancer as me, but that's not necessarily relevant because you still have the same emotions. But it was good to see how people were coping with things emotionally, because as far as the medical side goes, you're going to be looked after, you'll get the best possible care, everybody will do everything for you. But emotionally, you've got to deal with it in your little world and your family. You've got to deal with it. And seeing how other people have done it was a big help. It maybe just silly things like, I don't know, taking a dog a walk once a day or anything, and all that sort of thing helps. And it's like having a purpose every day.
Yes.
And that really, really helps.
Did you get guidance along those lines?
Oh yeah, lots of guidance, not only from the online, from people I met, from leaflets I was given, all sorts of guidance, even just a telephone conversation.
Yes, like you say, having that contact, you know, even over the telephone can be quite powerful.
Yeah, and it's wonderful. I mean, Margot, the lady who came and seen me, I knew I could pick the phone up if I was having I don't know, you have your bad days, you have your real down days, and you think, I've just had enough of this, but I knew I could pick the phone up and she would come. Yeah. If she didn't come, one of our colleagues would come.
Absolutely.
And it's nice, you're not necessarily going to use it, but you know it's there, and that is wonderful.
Yeah.
You're not on your own. There's people there battling with you, if you like.
Yes, or you might have to reach out and ask for it.
Of course.
But, generally, in many centres, they are available.
Yeah.
If you do ask. Ask.
And I think that's part of it as well, learning to ask for help.
Yeah.
Because a lot of people in life will go along and not ask for help. Yeah. They have like this independence thing, but you need to learn to ask.
There's an assumption if you don't ask that you're managing fine.
That's right, yeah.
And then you may not be offered something that is available.
Of course, yeah. It's like anything in life. If you don't ask, you don't get, do you?
Okay. You were telling me about the operation earlier, but I just want to pick up on one or two things. So, about 8 weeks after the cancer, you had the operation.
That's correct.
But the operation was obviously a major operation involving how many hours, did you say?
Altogether 12 hours.
And how many surgeons?
3 different consultants.
All in the room together?
All in the room, plus obviously their individual backup teams.
Yeah.
And also they filmed the operation as well.
Really?
So there was somebody in there filming it.
For an educational purpose.
Education thing, yeah, because obviously that might be relevant in years to come.
And tell me the story you told me about how they decided where to go.
Oh, well, what it was, because there was urologists involved, plastic surgeon involved, and a cancer specialist involved. I see my urologist at the Leicester General, but I see Mr. Offer at the Leicester Royal, and there was like a battle going on between them. Where should this be done? Should it be done at the General? Should it be done at the Royal? And they was both trying to get me to come down on one side or the other. And in the end, I just said, look, I'm not really bothered. You do it in my shed, just get it done with. And eventually Mr. Offer won it. It was done at the Leicester Royal.
So you said, you can do it in my garden shed if you want.
Yeah,
as long as you
just do it.
And did you know how good the result would be, or was it just an uncertain thing for you?
No. I mean, to be fair, all 3 consultants did explain that there was no guarantees. And if it didn't work, they would have to go back to square one and remove the penis.
Yeah.
And I went in knowing that. I went into that with my eyes open.
Yeah.
But there was that chance there. And I think if there's the chances there, then grab it with both hands. Because at the end of the day, I knew then that whatever happened, I wasn't going to lose my life through this.
Yes.
Whatever they had to take away, they had to take away.
Yeah.
And life is far, far more important.
Can I just see if I interpret you correctly? Because there'll be some people on this watching this video who haven't had the benefit of that very new operation, who maybe had to have the removal of the penis in their case. If I'm understanding you correctly, you're saying that it's still important to strive for the ultimate outcome to, prolong your good quality of life.
It's all about quality of life, survival, and not only for yourself, for your friends and family.
But by the same token, you don't necessarily, everybody would be afraid of losing, the penis if it was threatened. I think what you're saying, if I'm interpreting you correctly, is that you were prepared for it.
I was prepared for it, yeah. I mean, at first, of course, it's a shock. It's bound to be a shock, and it has an effect on you.
Yes.
But then you've got to try and see things in black and white, which is more important. And your life is far, far more important, and to those around you.
If it had come to that, did they discuss any options for you, like, for example, different types of plastic surgery or implants, prostheses, and all things like that?
Yeah, that was all discussed with me, but obviously that road wasn't gone down, didn't go down that road too far, because we wouldn't have really progressed on that if things hadn't worked out as they had.
I see.
But they did explain that side of it to me.
Yeah.
And my urologist also explained that if necessary, so you and your wife could even have some form of sex education.
Yes.
To get over the relationship side. He said, yes. Because there's always things that can be done.
In other words, there's planning for each eventuality.
Exactly. Yeah, there's always a plan in place.
Okay, but in fact, it turns out that you had this cutting-edge procedure, and obviously it was highly successful from your point of view. Were there any other hidden either benefits or hidden hazards which you weren't aware of but had to face later? For example, I'm thinking of your weight or diet or other things, anything.
I think weight loss was always an issue with me because I'm quite a small person anyway.
Yeah.
And like any weight loss for myself has quite a dramatic effect. But I was lucky enough that when I came home from hospital, a dietitian got involved, which was all organised by the hospital, and just put on a high protein diet.
Yes.
Which at first I must admit I didn't feel like eating, I didn't want to eat. But eventually you get there and almost got my weight back to normal now, still a little bit off, but almost there now. And it's a case now of little and often. So in a way you change your eating habits a little bit, but you get there in the end.
So what amount of weight did you lose?
Well, normally my weight is just over 9 stone, and my lowest weight was 5 stone 2. I went down to, so I just looked awful. I looked like a skeleton.
Really?
Absolutely awful.
That is very light. I mean, I know you're, what height are you?
I'm only 5'2".
Yeah, but still 5 stone is really, really...
Yeah, I looked awful, absolutely awful.
And then you put that back?
Yeah, I've almost got it back now. I'm just coming up to 8 stone now, so almost there.
What do you think the reason for the weight loss was?
I think, crikey, there's a number of things involved. I think it's feeling physically ill. I think it's a mental thing. All sorts of it. The tiredness, felt so tired because the cancer had progressed. Yeah. Pain. Lots of things was involved in it.
Yes.
Lots of things.
A combination of factors.
Yeah, and they all sort of add up together.
And now, what's your appetite like?
Really quite good. Yeah, quite good. I wouldn't say it's 100% back to normal, but I'd say we're 80% there, and yeah, it's quite good now.
How long are we after the operation now?
Now we're looking at, what, 8 weeks down the line.
So quite recent.
Yeah.
8 weeks on.
Yeah.
How far back to normal are you now?
I'm back at work now, even though it's only part-time. I only do 3 days a week, but that helps me. And it's like getting out of the house, seeing other people, no disrespect, seeing different people apart from the family, taking your mind off it, because as I was speaking about earlier, it's always at the back of your mind, is it ever going to come back?
Yes.
And I don't suppose that'll ever go away.
There's that fear, isn't there, in the background, and sometimes that's helped by some medical information. What do they say
that's
about
right, yeah.
staging and outlook?
Yeah, I mean, I'm still very lucky. I mean, both the Leicester General and Leicester Royal are both keeping an eye on me. My urologist is, my cancer specialist is, I'm still having scans. And so far, so good.
Yeah. What have they said about your outlook? That's the prognosis of the cancer.
It's looking very good at the moment, very, very good.
Yeah.
And obviously, while they keep looking after me, then I'll keep going on.
Yes.
Yeah.
Right, we're a few months down from the operation and you're getting back to kind of normal now. I would think you're in a kind of rehabilitation process of getting your life back, and you said you're back at work, you know, for one thing.
Yeah.
What work were you doing most recently?
I do health work, going out looking after people in their own homes.
Yes.
And that was part of the reason I wanted to go back to work, to give something back.
I see.
Because obviously in my type of work, I see like past cancer patients.
Yeah.
And it helps me mentally, thinking, well, I'm helping somebody else who's either starting to go through what I've been through or has been through what I've been through. And it's a sense of well-being.
Yes.
That's what it's all about, a sense of well-being.
Also, you've got a role back, which you temporarily had to put to one side.
That's right, yeah.
Because of your illness.
Yeah.
How long were you off work altogether for?
About 6 months altogether.
Yes, quite a while.
Yeah, a long time.
Was it nerve-wracking to go back, or did you feel you could get back into work quite quickly?
It was one of the most nervous days of my life. But it was like first day at school.
Yeah.
Yeah, very nerve-wracking.
Was there also an issue about what people knew?
Yeah, I mean, I was very lucky. The company I worked for kept everything in the office. It was very confidential. That was my choice, by the way. And the reason I said that is because the type of people you go to when you're looking after them in their own homes, they've got enough to cope with without worrying about other people.
Fair enough.
And I wouldn't wish that on them. It's not fair. They have their own issues. They don't need other people's.
So you chose not to kind of release that information.
Yeah.
So that kind of made it, for you anyway, easier perhaps to go back.
Yeah. A lot easier. A lot easier.
Yeah. Obviously, that's a personal decision to know, to decide whether your colleagues, and not just your colleagues in your case, but patients, were informed or not. Did you get quickly back into the role though? Because you were coming across other unwell people, like you said, some with cancer. How comfortable was that after the fact that you'd been diagnosed?
In a funny sort of way, it felt more normal than it was before, because you got the background and you knew what they were going through, you knew their emotions.
Yes.
Physically, you knew what they was going through. You understood what type of treatment they were getting, the people they were seeing, and even to like pass on a bit of information, even if it's only the tiniest thing that may help. You know, if it's only, I don't know, pass a phone number over, anything.
Yes.
You think, well, that'll probably help them now.
Yes. So you had greater information and insight into
because you've had personal experience of it.
Yeah. And did it change your relationship with those patients at all?
Yeah, greatly. Yeah, it made me understand them more.
Yeah.
Understand just the day-to-day needs. And like sometimes perhaps all they want to do is have a chat to you. And like spend a bit of time, and if it's only, I don't know, 20, 30 minutes having a chat, and that makes them feel so much better.
Yes.
So much better.
Yeah.
And in a way, it made me feel better as well. If that might sound a bit strange, but it did make me feel better.
I can understand that. You were able to talk with them, and because you were helping more, you felt better.
Yeah.
You were more informed. They were helped more.
Yeah.
Yeah, it's a kind of a virtuous circle in a way.
That's right, yeah.
Yeah. Now that's your relationship with your patients and clients at work. But what about friends and other contacts? Were they informed?
Certain close friends were informed. I'll be totally honest, not everybody was informed, but certain close friends was informed, and they was all really, really good. And it changes that relationship.
It does.
They become more precious to you, and hopefully you to them. And I think I have done. And it makes you value the friendships more. And perhaps take a bit more time for them as well.
Now you have a cancer, if you don't mind me saying, that the public might be more scared of, or some might say there could be a stigma associated with it. It's not the only cancer that has that condition, not the only medical condition that has that label, if you like. But does it mean that there's more of a barrier there that you have to break down? Or?
I think there is, yeah, definitely. Because it's like when any man hears that, you feel, wow, you know, this is like the end of life as I know it, sort of thing. I mean, I don't know whether, I think it was, I mean, for me personally, I think it was easier being married, my wife knowing everything from day one. What it would be like if you was a single person and not even got into a relationship yet, that might be more difficult, or it might be less difficult. It all depends on the person. But for me, I would sooner have found out being married than being on my own.
Or at least in a supportive relationship.
Exactly, yeah.
And the fact is, you described earlier, your family were literally involved from the day you were told.
That's right, yeah.
They actually went along with it.
We all knew at the same time. Yeah, so it really was from day one.
In a sense, they were invested in it, and they were also told by that, you know, medical professional. It didn't put you in a slightly difficult position of then having to tell them later. Do you know what I mean?
That's right. Yeah, and I just don't know how I would have done that. I mean, I didn't have to do it, but I just don't know how I would have done it. I mean, obviously I'd have had to, but I don't know how I'd have done that. And I mean, perhaps that helps some people rather than tell family members or partners themselves, having somebody there with them to say, right, this is what's happened.
Yeah.
And perhaps that would be a good thing.
Well, we try to encourage that to some extent by having sometimes the offer of a patient advocate.
Yeah.
Sometimes called PALs, but there's various types, and in the US they have very strong on patient advocates and navigators which help the patient go through each step in a supported way. We're perhaps learning to do that more here. We should invest more in that, definitely.
Yeah, because I think that would be a great help. A great help.
Returning to this issue of the stigma, did you ever come across any odd or unhelpful or surprising reactions, or was it all good, if you see what I mean?
There was a couple, not from professional people.
No.
There was a couple of my wife's friends who couldn't cope with it at all. I know them, but they're not my friends, if you know what I mean. They're more my wife's side. And they couldn't face coming to the house at all. They would ring, but they would never speak to me. They would only ever speak to my wife. And they just didn't cope with it. Now, these are not like young people, they're both professional people, but just couldn't cope with it.
Yeah.
But I did understand, and perhaps emotionally they just didn't want anything to do with it, I don't know.
Sometimes people are scared of the concept of the diagnosis, so they don't want to be associated with it because it raises an anxiety in them.
Yeah.
Sometimes it's more that they don't know what to say in a supportive sense. They're kind of a bit stuck.
Yeah,
so
that's what my wife said. They just wouldn't know what to say to me.
Avoid the situation.
Yeah, so that we just didn't see them.
Yeah.
mean, I've seen them since I've been better and I'm well.
Yeah.
But while I was ill they just didn't come near.
Yeah.
And they didn't really have an awful lot of contact with my wife, which was sad in a way, because it's not just me who needs support, it's your partner that needs support as well.
Definitely. Speaking of which, how did she cope overall as time's gone on with the situation?
At first it was difficult, very difficult, but she was lucky in her place of work where they have a consultant there, and she was able to have consultation during working hours.
Yes.
So that was a real big help.
Yeah.
And all sorts come out of the woodwork, surprisingly enough, when she started that, of how worried she was about, not just me with the cancer, but generally because of health issues and things that she'd not told me, which was fine. I didn't mind. That was great. It was great that she got it out in the open. So it helped her an awful lot. And also my son is lucky enough to go to a school where they have a counsellor there for different medical issues that parents may have, because unfortunately his schoolwork was affected, which both me and my wife expected. We expected it to be affected. And he had counselling at school, and he's still having counselling at school, which I know is a big help to him. And he refers to this lady now as a friend, and which is great. I mean, he even bought her a Christmas present. It's lovely. They've got a really good relationship.
Did you have to fight for that?
No, not at all.
No.
We did contact the school. Well, my wife did. When I was having treatment, saying how worried she was about my son. And the school then sent a representative to see my wife, explain what they could do, and it was put into plan the very next day, which was excellent. And the same with my wife's place of work. Obviously she told her manager about what was happening, because there's time off work, there's childcare to think of, there's all sorts to think of. So she had to put her in a situation, and I think it was about a week later a gentleman came to see her and said, they didn't ask, they'd already arranged the counselling, and he's seen her a couple of days later, she's seen a gentleman at her place of work, so that was great.
And how helpful has she found that?
Oh, she loved it, absolutely loved it. Because like I said, it wasn't just the cancer side of it, it was lots of things came out, which is great, really good. I think it is anyway.
She could air all her issues, if you like.
That's right, yeah.
And it's an independent person, isn't it, from the family?
That's right, yeah. And you're somebody you can tell anything, and you can say anything, because you know it's only going to be kept between those two people.
Yeah.
And any information is only ever going to be used for her benefit, if you know what I mean. I think as far as my son goes, going back to him, he was a little apprehensive at first, like talking about his dad to this strange lady.
Yes, of course.
And sort of telling this lady about what's going on at home, and you know, how's mum, and all this sort of thing. He was a bit apprehensive, but obviously he's a lot younger. But once he got confidence in the lady, then he's been great. And like I say, now they're best of friends.
Yes.
Really, really good friends, and that's great.
And that just shows you that there are resources if needed for others.
Oh yeah, because at the end of the day, it's not just the patient, it's your whole circle that get affected. Yeah, silly.
I'm just trying to now imagine, you know, the steps required to get back on your feet, and you know, to go through that rehabilitation, and also the expectation, you know, because you're anticipating in those early stages the worst, and then you had the surgery, which there's no guarantee. They may have had to reverse it or gone back to basics.
That's right.
But in fact, it went well, but then you're the cutting edge of procedures, so there could be a little bit of uncertainty or, you know, nervousness, shall we say,
of course,
about how your body's going to respond. So, you know, when you got back home and you started to settle in, what was your reaction to things, and how did you feel overall things were progressing? At
first I was very unsure, because like having this foreign skin on your body, and also your penis made of foreign skin,
yes.
as it were. Made me very unsure of things, and I've, you know, is everything going to work okay, and so on and so forth. And there is a funny story about me having a bath. I was very worried about my cleanliness because of operation, I wasn't allowed to have a bath or a shower. And although I had the odd shower, I did really want a bath. And one particular afternoon, I'd got in this bath and I was lying there and I was a bit dozy. And I looked down and I seen something floating on the water, and I shouted to my wife, I don't know what they've done, but it's fell off, my pigskin woolly has fell off. And my wife came running upstairs and looked in the bath, and she says, you're a silly devil, John, it's one of Ava's toys, your woolly's absolutely fine.
So, that's hilarious. So, yeah, you were kind of primed to thinking, oh, something could go wrong in a way.
That's right, yeah.
Obviously that was fine on that occasion. Did you feel because you'd broken the rules slightly with going in the bath too early?
Yeah, I thought, well, it's your own fault. I shouldn't have gone in a warm bath. Perhaps I've melted everything, and this is judgment on me. But no, everything working fine, and like I say, personal relationships, we found out that they were fine, and although it took a lot of planning,
yes,
because of 2 children in the house, I wanted to make sure everything was all right. So over the course of a couple of weeks, we did manage to get friends to look after the children for an evening. So it was all planned meticulously, this personal relationship side. So it was like nice meal, bottle of wine, went upstairs to the bedroom, and it was just like honeymoon all over again. Both very nervous, but it's like I said to my wife before, I didn't want to sort of start this and come screaming and shouting out the bedroom saying that nothing's working in front of the children. But no, absolutely fine. Obviously there was a period where there was no intercourse allowed, yes, because of the operation, and also prior to that, because I was so ill, personal side of the relationship was just non-existent. Yes, totally non-existent.
And that was roughly how long?
Around about 6 months. Yeah. But obviously that's not the most important side of your relationship. It's about well-being. And
did you maintain that personal warmth between you?
Oh yeah.
Even though the intimacy was less?
The affection side of it increased 100%, without a doubt. It probably sounds silly coming from a man, but lots of love, lots of cuddles. Even if it was just sitting on a settee holding hands, yeah, which is, I'll be honest, something we would not normally do. But yeah, that side of it went up 100%. Yes. And that's, in many ways, that is just as nice, yeah, just as nice, if not better. Yeah. Because every segment of a relationship is important, every segment.
I guess by the close intimacy side being slightly on the back burner, you could focus on other aspects of the relationship. That's
right, yeah. And it's like making time for each other and just talking to each other. And I think we both got a lot of things sorted out in our own heads at that time. A lot of things. Yeah. Like my wife's concerns for me, mine for her, and things that you wouldn't normally talk about. Yes. So there is a positive side as well. It's not all down.
No. Has it affected your relationship? I'm guessing in a positive way.
Yes, definitely.
Over time.
Yeah, because now you treat each day with a bit more respect now. Try and make a bit more time. I mean, if you are in a relationship for your partner, if you're lucky enough to have children, make a little bit of time for the children. Don't just sort of get them home from school, do the homework, have the tea, have a bath, go to bed. Spend, if it's only half an hour, a little bit of time each day, and try and make each day count, not just for you, but for the people around you, whatever type of relationship you may be in. Or if you live at home with mum and dad, make time for mum and dad.
So on a personal note, it's affected your outlook, your view on life?
Without a doubt, in a positive way though. Yeah. But that is only down to the medical profession, the backup services, the help I've had. It's down to everything coming together.
Yes. And there were low times, weren't there, along the way?
Oh, some very, very low times.
I remember, you know, we met when you were suffering a little bit along the way. But it's remarkable to see that progress.
Yeah, I mean, you have your bad days and you think that you're never, ever going to get over it. And this is like always going to be the norm, that you're always going to be this ill or feel this low emotionally, or you'll feel some days there's nobody there to help me, but there is. And there is light at the end of the tunnel. You've just got to find that light.
Did you come across any patients along the way who you made a connection with?
One or two, yeah, when I was in hospital. Some not as bad as me and some a lot worse than me.
With a similar condition or different conditions?
Different conditions. I mean, still cancer, but different types of cancer.
Yeah.
And yeah, it was good to talk to them as well, to see what they were going through. Like I say, some bad and some not so bad. But on the whole, I think the people I spoke to, the patients in hospital, they was all fairly positive. I noticed when I was in, they was having like Macmillan people going to see them and so on and so forth. They was all positive.
Yes.
I mean, they're all worried. They're bound to be worried. You can't help that. No. But they did have that positive outlook.
Imagine now a new patient who's at the beginning of their cancer journey, maybe recently diagnosed, maybe with a similar condition to yours, but at the beginning with all those worries and uncertainties. Is there anything that you'd like to say to them now while they're watching this that can help them in their situation?
I think probably the hardest thing is to learn to share your emotions. Try and be open if you can. Above all, be honest with yourself. Don't hold anything back. Be honest with yourself. And if you can't, when you talk to people, even if you don't tell them your whole story straight away, try and get a little bit of burden off your shoulders. Not just with the professionals, obviously with family and friends and partners. But I think the main thing is to realise that people are willing to listen to you. Whether it be for 5 minutes or 5 hours, there are people there. And, you know, try and utilise that help as best you can, how it's going to help you. You may not want help. It may just be one session, one phone call. If it is, great, that's wonderful. But never think there's nobody there for you, because there is. And if you can't find help yourself, then somebody will find it for you.
Do you think there's a slight danger that with the cancers that, let's say, are, the public would say, are slightly embarrassing or fearful, that people tend to keep them almost like a secret from their close nearest and dearest?
Without a doubt.
And then what that means is there's a slight disconnect when they want help, because not everybody knows their situation. That's
right, yeah. That was what I meant by being honest with yourself.
Yes.
You've really, really have got to be honest. And, you know, when you find out, you know, like me, that you've got penile cancer or whatever it may be, you really, really need to share that as soon as you can. Because if you don't, and say you don't ask for help, say you don't tell family members or you don't tell partners, and you try to have treatment secretly, at the end of the day you're going to be ill. You will be so ill, because nobody can carry that burden. You need to share it, and you'll find out then who your real friends are, who are the family members you can rely on.
Yes. And as much as that is not a pleasant thing, because you do maybe lose a few people who are not supportive, it does, on the other side, clarify who is helping you, and you can use that in a positive way.
Of course you can.
And you know what? The people who are helping often feel better for having helped you.
That's right, because they feel as though they've got a purpose.
Exactly.
And they feel as though they've done something.
Yes.
It may be the silliest thing in the world, but they will then feel better knowing that they've helped you in whatever sort of way.
Otherwise, they feel slightly excluded sometimes.
Yeah, they do.
And can feel, well, I'm not being told anything.
Even children, I mean, I can only speak for myself. Like, my little girl had passed me a cup of tea off the sideboard or something.
Yeah.
But to her, that was a big thing because she gave her daddy that tea. Yeah.
That's it. I'm wondering where you see yourself in the future now and how you see things progressing. How far ahead do you look?
At the moment, I'm probably just thinking about the coming year. I mean, I'm optimistic, but there's like this guard that goes up. You don't want to be over optimistic. Try to be more sensible as regards my own health. I've not always been sensible, I admit that. I don't always eat the right things, do the right things. So try and be a bit more sensible in that way.
Yeah.
And also, I mean, even I think it was last week, I was feeling a bit low. Now, normally I wouldn't have said anything to anybody. I've just kept it to myself. But I came home, I was on my own in the afternoon, and I just picked the phone up and spoke to a friend. And then my wife came home and I told her about it. Now, go back 8-9 months, I would never have done that.
Yeah.
Never have done that. So it teaches you to be open. And it teaches you, well, you're being yourself more.
Yeah.
And that helped me no end just by picking that phone up.
Very interesting, very interesting. John, I think your story is an amazing one, really. I mean, just on a personal note, your way of coping and your personality and a sense of humour, it comes through. And I think those are all assets, you know, to help us cope.
Yeah.
So all those positives, they can offset, you know, those stresses coming in from outside, and that can stand you in good stead, you know, both now and in the future. But also, you've been subject to, you know, a feared cancer, which you have addressed, and you've also had that amazing cutting-edge procedure, which is really on the limit of medical technology. And now that's quite amazing to hear about. So I really want to thank you for coming in today and sharing your story. Obviously, I wish you all the best for the future, and you know, you're very welcome to come and give us an update on how you're getting on.
With pleasure.
In a little while, if you like.
With pleasure.
Take care then.
Okay, thank you.